as they are catalysts in creating more awareness to our age-friendly action plan. We know that the age-friendly action plan domains of livability address key priorities and support older adults as they age. As we know, COVID-19 has disproportionately affected older adults. The pandemic has disrupted the way we provide services, the way we do our outreach and engage with older adults. These forums will allow us to highlight many concerns and provide tools and resources to create our new normal. So by now, I'm sure you all know why you're here and even the title. The title is From Disruption to Invention, Healthy Aging After the Pandemic. Is there a new normal? Today, we are joined by 3 individuals who are all and surely experts in their own right. Our first panelist is perhaps I should say, the City of Austin's Public Health Director, Ms. Stephanie Hayden-Howard. Our next panelist wears many hats. She is a commissioner with the Commission on Seniors, and she also served as Director of Aging Services with the Capital Area Council of Government. Lastly, from the state of Texas, we have Ms. Olivia Burns. She is not only the coordinator, but she also serves as the liaison to the Aging Texas Well Advisory Council. Welcome, welcome, welcome. We're so excited that you guys have decided to join us today and take time out of your very busy schedules to be with us. At this time, I'm going to ask each of you all to take 3 minutes to give the audience a brief overview about what it is that you do at your organization and how your organization's roles and responsibilities have shifted during this pandemic. Ms. Bordie, would you please get us started?
Okay, just making sure everybody can hear me. Cool, okay. I'm Patty Bordie, the Director of Aging Services at Capital Area Council of Governments. I serve as the Director of the Area Agency on Aging of the Capital Area and the Aging and Disability Resource Center, housed as a program under the AAA, we call it. We are charged through the Older Americans Act. That's where our funding comes from predominantly. We also have other funding sources to identify the needs and then provide services to meet those needs of older individuals and their family caregivers across the 10-county region. So we serve Travis, Hayes, Williamson, our very urban counties, but also 7 other counties surrounding those 3. A lot of those counties can be very rural. We are housed at the Council of Governments because our main charge is really that planning piece. And that is why the Council of Governments were established, to plan for regional, to meet the region's needs. And we really take that to heart, the whole idea of regionalism, of, we understand that people in our outlying counties are using services in Austin. How do we coordinate that? So it's everything from support services for caregivers, individual in-home services for people needing that type of assistance, information about Medicare, Medicaid, access for people with disabilities to long-term services and supports. We also have a small program called the Ombudsman Program to advocate for residents in nursing facilities. And as you might have guessed, most of those services were provided directly in the home, in the community. And when COVID hit, almost everything, just about everything initially went virtual as quickly as we could. So we'll talk a little bit later about what that looked like, how that changed our definitions, how that changed our service delivery, and some of the lessons learned. So that's it in a nutshell. Our services are free of charge to all consumers who reach out to us. We ask for contributions, but it's mainly there because these are really federal funds funded through the Older Americans Act, your tax dollars, so everybody has access. The only eligibility is really that you be 60 years or older, and in some programs, even a younger eligibility. So I look forward to giving you more information about our programs and services, pre-pandemic and post. Thanks.
Awesome. Thank you, Director Bordie. Next, we're going to go to same question, Ms. Burns.
Great, thank you, Tabitha. I'm excited to be here. I really appreciate you all having me. So as mentioned before, I am with my name is Olivia Burns, and I'm with the Texas Health and Human Services Commission. in working in the Office of Aging Services Coordination. Texas Health and Human Services is designated as the state unit on aging. And so as Patty was touching on, we kind of oversee the Older Americans Act funding that is designated federally for older adults, and funnel that to the area agencies on aging so they can do their good work. My office doesn't directly oversee kind of the day-to-day aspects of delivering the AAA services, but we do work to support the offices that do. We help coordinate the state aging programs to help individuals and communities age well by developing information, resources, tools, and initiatives to create more awareness of aging services, the trends and issues. So we are really a kind of a high level planning, forward thinking kind of office to help connect individuals, community stakeholders to different offices and programs under the HHSC umbrella. And a lot of the work we do includes elevating kind of the older adult needs and issues that we receive feedback on from the different partners and stakeholders we work with, including the Aging Texas Well Advisory Committee that I provide support to. So we really rely on individuals and communities to let us know the different needs or concerns in their community, kind of like Patty was touching on those different plans, so we can help at the state level ensure that they're addressed in strategic planning, policy planning. So on a broad level, the pandemic did have a significant impact on HHSC and just the way people were doing things. There was a big effort to transition almost half the HHSC workforce. And of course, we employ people all across the state. And I think we're about the third largest social services agency in Texas. So that, as you can imagine, trying to transition people who were traditionally working in an office and that maybe not had a lot of experience working remotely, that was a big kind of endeavor. But given kind of the environment with this maintaining social distancing, other types of things like that, it did go rather smoothly. And so we're, ongoing operations are really focusing on kind of the ever-changing situation of the pandemic and monitoring, as vaccinations are more readily available, thinking ahead, trying to plan how are we going to bring back a lot of that workforce, back to the offices and back in person, especially to those eligibility offices that may have had to transition part of their staff to home and they're not having as much face-to-face client contact. And then specifically to my office, Aging Services Coordination, we pretty quickly inserted ourselves kind of in a lot of different conversations and across HHSC to make sure that older adults, the providers that were providing services to older adults, and anyone kind of with a vested interest in aging was those issues and needs were heard. And so we did a lot of triaging, individual concerns, feedback from our stakeholders. Of course, we did, engaging the advisory committee and requesting that, they look at the different regions that they represent, the different areas they represent, and providing feedback on local things that they were doing. And, just kind of growing and learning from, the different growing pains. Of course, transitioning to all virtual meetings for our advisory committee was kind of a learning curve for everyone. And it still, can create some challenges, but overall, I think just the way kind of on a broad level that the state has been operating has gone pretty smooth. So thank you.
Thank you, Ms. Burns. And lastly, Director Hayden-Howard.
Well, thank you all for the opportunity to be here today. I was really excited to see the invitation coming forward. And so just just excited about being here, and thank you, Tabitha. Austin Public Health, the words I always tell folks to be able to remember is to remember to prevent, promote, and protect. And so our goal is to make sure that we are preventing disease from spreading in Austin and Travis County, city of Austin and Travis County. But we're also wanting to make sure the well-being of individuals and doing everything we can to promote well-being. And then, we're always thinking about, how we can, as an organization, just be a partner. As most of you know, Austin Public Health has been, I've been one of the incident commanders in this COVID response. And so kind of during, this time, we've got to really be able to make the decisions to keep Austin and the residents that come and the visitors that may come safe. And so a significant amount of communication, setting up websites, dashboards, et cetera. And if you've not had the opportunity to look at our website, we updated and made changes. Hopefully it's more user friendly. And so later on in my presentation, I will share some additional information about the response. But outside of the response, public health, for a lot of folks, they really didn't know what public health was before the pandemic. There was an idea that we were a healthcare industry and we provided healthcare, and we do not. And so public health is very much concerned about the prevention and really kind of looking at a population of how, we can, when we're thinking about, aging, wanting to make sure, the determinants that tend to make us age, that there are those protections in place. So, ability to walk around and have sidewalks and be physically active, but have that access, to healthy foods, and making sure, kind of within the space of relationships. We're relational people. I mean, that's kind of what we all do, And so, I recently, we've kind of started to open up things a little more. Definitely change the way we do business. To be honest with you, we have some people that volunteer for us, that we're seniors, and so for us, a lot of things, we were able to kind of bring things back in, kind of pause on our service delivery, and then reinvent of how we were doing those. And so kind of looking at capacity and how many patients are coming in, et cetera, because we do run a sexually transmitted infection clinic, and we do provide services to people that have TB. And so making sure that we open those up pretty quickly. Even immunizations, we provide immunizations. And so there were so many people that were not, and even, people that have small children, they were not bringing their they were not bringing their children in for the immunizations. So there, in lies another problem, is that we have a lot of young ones that really need to catch up on their immunizations. And so definitely, being creative and, but all thinking about, the health of the person that's coming in, the health of the staff people that are working for Austin Public Health with the public, and just, ultimately keeping everybody safe. So thank you.
Awesome. And as you all have heard, I'm sure you understand that we're in for a great treat and rich dialogue. And I told you all, they're experts in their own right. I told you all in the very beginning. And with that said, we're going to jump right in with our questions. And panelists, we really want you all to feel free to jump in right after each other. I don't want to have to call on anyone, and I'm sure I won't have to, because you all are great. You all are so great. And so our audience, we wanted to just say, please hold your questions to the very end. We'll have approximately 30 minutes for resource sharing and for you all to ask your questions. So Director Hayden-Howard, she really actually, you just spoke about this when we're talking about healthy aging. And what I want to know is, has this term healthy aging, that definition, has that changed due to the pandemic? And if so, how?
You know, the COVID has really changed so many things. It has just kind of changed all of the things that all of us have really taken for granted. And so keeping in mind the things that have been allowed us to be healthy and, you know, not get COVID-19, or, you know, for the people that did were affected with COVID-19, that have, you know, they were hospitalized and now they're feeling much better. We know that there are definitely the potential for challenges, you know, on the other side of having COVID-19. And so I'm going to say, at the kind of thinking of those things in mind that we need to continue to do to remain safe, we've got to continue to do those things: hand hygiene, distancing, wearing your mask. But at the heart of kind of healthy aging, and when we start to kind of think about, you know, those, you know, choices of, you know, kind of the best way to move along in our lives, you know, we want people to, you know, continue, you know, the relationships, and you know, attitude is definitely, you know, it's all about how you feel about a situation. You know, we can see this as, okay, I'm not going to do anything. I'm not going to go anywhere. I'm just going to, you know, be isolated and not have contact with people. And we don't want that. You know, we want you as an individual to really kind of think about, how can I use these protections that I have? And it's like, you start asking questions to people that you, if you were volunteering before, ask the agency to say, you know, what is your, what kind of guidelines do you have in place? You know, how are you going to keep me safe if I decide to come back to volunteer in that space? You know, what kind of precautions are you having for people that may be coming in? But have your questions, get your questions, answer your questions. You have to make the best decision for you. But what I don't want people to do is I don't want people to isolate. We need those, as I said earlier, we're relational. We love relationships. And those are the things that, you know, it just, I mean, you know, it keeps us with a young mind, I'll say. Because, you know, we're talking to people, we're learning, and we're being active. You know, there's folks that maybe went to the rec center and then kind of walked around the rec center because it was in an indoor setting, you know, or folks that kind of had friends that they walk with. Ask your friends or people in your circle, you know, did you get your vaccine? That's going to be a common question that my hope is that we start asking people, did you get your vaccine? And my hope is that everyone on here has received their vaccine. And if you have not, send me an email and I will get you scheduled. So my hope is that everyone gets their vaccine, but you're asking people in your circle, have you had your vaccine? Are you fully vaccinated? You know, and that way you can make the best choice for yourself for safety in this new normal.
Okay.
Thank you. That's great. Go ahead, Director Bordie.
I can chime in. You asked if healthy aging has been, you know, has the definition changed? What comes to mind is, first, one very significant change in our programs. For our home delivered meals program, there is an assessment that's done, and you have to meet the criteria to access a home delivered meal. When COVID hit, that criteria went out the window. The fact that you had to stay at home and shelter in place became the only criteria for receiving a home delivered meal. So the volume tripled within the first week for our staff, for our local providers. But what that really pointed out to us was, you know, and you know, it wasn't just about people's functional abilities. It was really about access. I think what we learned and the way to define healthy aging, it's just as much about all the other things. Do I have all the determinants? You know, it's just about, do I have the transportation? Do I have the social relationships? Do I have access in a language that I understand? Do I trust the people that are asking me to do something or providing the service? That was really something that we started talking about pre-COVID, but when COVID hit and the pandemic, it really hit home that all of those things, do I have the education that I need to understand the transportation? That, you know, do I really know how to get what I need and how to even ask the right question? So that's something that I think healthy aging for us now, we're not just looking at, are you healthy clinically, medically, you know, with whatever condition you have? It's more, do you have all the other things in place that you need to get what you need to address your health? So, and people really started to bring those things up to us, you know, and it made it abundantly clear. It also meant that, as you asked the question earlier about telehealth, that you didn't just have to get your health in person or get your programs in person. We do health and wellness classes. They were almost all done face-to-face in a room, you know, right in front of everybody. We immediately pivoted. Our first classes came out at the beginning of April, online, on Zoom. And we found that that was just an amazing way to provide these classes. We weren't sure how it was going to go. I serve a 10-county region. Virtual classes meant I could serve the 10-county region. People didn't really need transportation to get to a class anymore. So that was sort of a silver lining. So we plan to really do whatever we can to keep those changes and that really change that access, to keep those in place even post-pandemic. So I think healthy aging is just defined in a much broader way than we ever imagined.
Yeah. Can you hear me okay?
Sure. Ms. Were you going to say anything before you?
Sorry, you may be hearing a meeting in the background.
Yes. It sounds like someone is maybe unmuted and on the
Hang
phone.
on a second. Let me see if I can turn off.
Yes, if we could, thank you so much. If we could have who's ever speaking to mute, please. Thank you so very much. Okay, let's go right ahead. Thank you.
Great, thank you. And I agree both with everything that has been said, especially in the isolation piece that Stephanie was highlighting, and also how I feel like the understanding of healthy aging has broadened, and also more awareness on what healthy aging encompasses. As Patty was touching on, you know, access was something that really was kind of catapulted to the forefront almost immediately. And that I feel the pandemic has not only highlighted those disparity equity issues, but also exacerbated it in some areas. And so I think because so many people were kind of experiencing those barriers, I think it broadens to how we think of healthy aging, and that, you know, it's not essentially just limited to the older years of someone's life. You know, everyone is constantly aging, and how you age can depend on your environment and access to services that you have. So definitely thinking about access to broadband and technology, not just for telehealth, but to connect with people. I think social isolation was one of the big issues that was exacerbated because a lot of people didn't have access to kind of the tech needed to be able to maybe engage in some programs or reach out to their loved ones. And so that's what I would say, kind of my understanding, that I think we did face really just stressful challenges. And really it highlighted a lot of serious issues for a lot of different underserved people. But I think there's a lot of lessons learned, and I think people are building on that as we speak to kind of make sure that this doesn't happen again.
Yes, thank you, Ms. Burns. I'm thinking about everything that was just stated. And so there's some words that come to mind like holistic approach. And I hear Director Hayden-Howard saying the holistic approach. Many of times we talked about equity as well. But one thing that just rings a bell for me is really collaboration in the way we engage with our partners. And so the next question I'm going to ask is, after all we've been through over the last year plus, the pandemic, trying to get allocation from the states for the vaccine, freeze-related water issues, power outages. I was one of those. I was very cold. Do you think the city, county, and state collaboration will change, increase, and how should other businesses, even nonprofit, step up to make sure that we're all joining arms together? And so this really speaks to that collaboration. And have at it, whoever wants to start, you're more than welcome.
I can start. So I think, I certainly hope that collaboration will increase and really expect that it's going to look different for communities and regions across the board. Some of the best responses to the pandemic kind of at the broader statewide level really were successful because of collaboration. One example that comes to mind is the statewide mental health support line that was almost immediately stood up when the pandemic first hit. And that was really launched in collaboration with the Harris Center for Mental Health and Harris County, Mental Health and Intellectual Developmental Disabilities. So they are operating this for the whole state, and it's a 24/7 mental health support line that anyone can use at any time. And I'm happy to drop that phone number in the chat. Another example, and I know Patty kind of touched on what this looked like in her region, but really the state working around the clock to make sure federal guidance around different funding flexibilities that the area agencies on aging could take advantage of to be able to ensure people were still getting the services they needed, including congregate meals. A lot of cool innovative things were happening, transitioning those congregate meal sites to like drive-through type of delivery. And so those are just two really good examples that stood out to me that wouldn't have been able to be successful without collaboration, really at almost all levels, federal, state, local, community, all of that.
Thank you. Okay.
I can jump in.
Sure.
I think, yes, out of necessity. I want to say, first of all, that, as a, employee of Capital Area Council of Governments, cities, counties, state, regional, we've all been working together for a really long time and trying to consistently improve our efforts to coordinate, whether it's around emergency preparedness, aging, whether it's around community development, whether it's around anything. Air quality is something that we deal with at the COG. That's a very regional, we need a very regional approach to it. So I want to applaud, all levels of government have been really trying to do a better job of this. And the pandemic just really put that again into overdrive. What I was very impressed by, and as Olivia said, some of our governmental entities really became far more nimble than we ever thought they were. Some of them also did face some real super challenges, especially around the storm, but they were reaching out and they were doing what they had to do to try to improve the coordination. Even around the vaccine rollout, I know we immediately were getting calls from all different levels of people. How do we do this? How can we fix this? We know older adults aren't able to use a website. What are we going to do? And so I think there's been a push to coordinate forever. I think we can all do a better job of sharing assets, mapping those assets, who has what, what's the best way to coordinate that. But then also our communications pieces. Are we all on the same page? Does it make sense? Is it consistent? Are our older adults feeling like I'm getting one message here and one over here? The coordination piece. And then the other important piece is really in the advocacy piece, and that messaging and that reframing and that talk about, how do we reach our older adults? Are we doing that together and consistently? So, I mean, we already have seen some coordination efforts, expand around meal delivery, around transportation, around emergency preparedness. We're lucky in Travis County, Hayes, our Central Texas Aging Services Council does that. So I really do think I see it increasing, and I also see us just getting better at it. And really, the more we do, I think we do, as Olivia said, the one last thing is lots of response came from the actual neighborhoods and the neighbors themselves.
Yeah.
How we tap into them, I would love to, really move in that direction, because there was a lot of energy and effort that was amazing and astounding.
Yes, it's awesome. And, and that's one thing we didn't say about our neighborhood associations and our neighbors. And these are the people who live right next to us, and they know more about us sometimes than our agencies. And so we're always grateful for the neighbors who check in on others, right? That you can save a life just by checking in on older adults, those who reside in your neighborhood. Okay, so we're going to move on to our next question. And I had one, but you guys kind of answered that. So we're going to move on to the next one. We know that older adults are living longer in Austin and surrounding areas, and we're becoming more diverse. And equity is always on our minds. Please share how your agencies have taken innovative approaches during the pandemic to reach those most at need, and even those who need special accommodations. I'm going to start with Director Hayden-Howard.
Okay, thank you, Tabitha. Equity has really, really been our North Star throughout the pandemic. And really even before, the department has a health equity and community engagement division. And that, really works its way kind of throughout the department, which transitions into programs that the department has. But during the pandemic, we established a social services branch. And that social services branch really started to establish other smaller groups that were focusing in on specific populations. And so seniors was one of those programs. But seniors and people with disabilities, victims of domestic violence, homelessness, just to name a few. But we wanted to be very intentional in our response to make sure that whatever needs individuals had, we were able to address those and make sure that that those needs were met. And so it started as things as food access, making sure folks had the food that they needed. The department partners with nonprofits contractually, and making sure that those nonprofits were able to, if they were providing food access or if they were providing financial assistance, making sure that they had what they need. So the service delivery provision would definitely continue. I will tell you that during this time, we started to even, we're always kind of looking at these things. We're looking at access to transportation, access to healthy foods, et cetera. But we really had to kind of keen in on that as well, because what ends up happening is that these end up being barriers for folks to access where they couldn't access testing. So we, stood up at home testing, or people that were homebound and they couldn't go out anyway. So, providing that testing at home. And so addressing transportation, challenges, partnering with Capital Metro. They've been very gracious to say, you know, if anyone calls us, we will take them to get their vaccine and back free of charge. And so those collaborations kind of goes back to the other question, always knowing we can always do more in that space. But the language divide, you know, when we look at our website and the materials, you know, that we have on our website, you know, we have 6 different languages that you know, folks can be able to, you know, get those materials. But then even, you know, establishing an equity line in January, working with grassroots organizations, and they were referring folks into us that did not have access to the internet. And so, you know, we started receiving, you know, referrals from nonprofits that were working with elderly clients that needed to be able to, you know, they either wanted to bring them in or they wanted us to partner with them. And so, you know, partnering with Meals on Wheels to go out with them when they do their deliveries of food, and be able to provide the vaccine with Family Elder Care, you know, the same. We partnered with the Housing Authority, and they had about 4 properties for people that are 62 years of age and older, or a person that had a disability. And so we sent our mobile teams out to be able to, you know, to provide that service. What the data shows us is the data did show us that older folks were disproportionately affected by COVID. There was a significant amount of severe disease, hospitalization, and death to individuals. And I'm sure, you know, these are things that you all have read over time. And so, so our strategy included in our vaccines efforts, because we really wanted to make sure that we were targeting folks that were 65 years of age and older with our vaccines, in order to make sure, you know, we are providing them with their vaccines. The other thing is the digital divide. You must always, in your best plans, that you're laying out things and kind of thinking about, you know, how can I address the digital divide? Always has to be a way for, you know, folks to call in. You know, we had established a line kind of early on during the pandemic. We had our nurses that were answering those lines, and some of our other health workers. And so when we switched to the platform, you know, we had, you know, over 4,000 calls in one day. And they were calls because they wanted to know about the system and resetting the password, et cetera. And I said, okay, now that has kind of taken away our area of where people would be calling that don't have access. And so we had to build that in with 311, where people could call there, which now they could set up accounts with us, et cetera. And then if our equity team will call them back, schedule an appointment, reschedule an appointment if they need it, but being very flexible to address, you know, kind of all of those needs, transportation, you know, language, digital divide, et cetera.
Thank you so much, Director. Everything you said, oh my goodness, we've done so much. And for those who may not know, I also have been serving as the Senior Task Force co-lead. And so, yes, everything that our director stated is very much so true. And just want to once again thank all of our many organizations who has been partnering with us during this time. Really quickly, I just wanted to also thank Driver Senior ACX, who have been also transporting older adults during this time. And Stephanie Lane has been one of those advocates in our community to ensure that they were calling our equity line and letting us know if there was any technical difficulties and et cetera. So thank you all so very much. We have one more question for you all, and I hate that we're coming to an end. This has been such rich dialogue. I wish we could just go on and on all day long, but I'll tell you, this will encourage you all to come back for our remainder series, right? So if you want to learn more about the digital divide and things that came up, you have to sign up and come back and bring a friend as well. So let me just ask this last question before we go into Q&A. How can we start now communicating about healthy aging to our younger generations? And I'm going to start with Ms. Burns.
Thank you, Tabitha. I really like this question. And I really think it kind of the root of it is thinking about how we talk about aging and older adults. There, of course, there were several very not so good examples of how older adults were discussed throughout the pandemic, about that they are high risk, but there weren't a lot of positive things said about them, and also just confusion on the different guidelines that were coming out, and kind of touches on a coordinated communication response to make sure older adults were getting correct information. And so the Frameworks Institute has a really good program called Reframing Aging. And so they've done a lot of research on the way people think about older adults, and different maybe internalized biases around that and around aging in general. And based on the research, and also based on older adult input on, what they would like to be called. Do they prefer to be called elderly? Do they prefer to be called an older adult? Would they prefer to be referred to as an elder? It can vary by different populations and communities. And so they really have developed good information for how to kind of reframe your thinking at the individual level. How maybe your organization's materials or things may not be as accessible for older adults, or maybe you want to kind of reword something. And then also just on a broad society level, rethinking on how we value our older adults in our life. And so I think that's one way that we kind of shift that. And so when we're modeling kind of that for the younger generations, I think that that will be a key thing to do. Also, really investing in intergenerational programming. There's a lot of cool, innovative intergenerational programs that are being developed, and some that have kind of come out of the pandemic. One is there's different youth groups or even college programs that are kind of doing a mentorship pairing with older adults, and they connect via the phone or computer and do chats. And it's not just focused on checking on, hey, are you okay? Do you have everything you need? But it's more from a place of learning from each other. And so depending on the program, there's different structured prompts that they can discuss, different ways to kind of get conversation growing and going and learning from each other. And so I think intergenerational efforts, activities is another way to kind of highlight healthy aging and kind of shifting the understanding, maybe breaking down myths or stereotypes.
Yes, and love that our age-friendly action plan really does focus on that intergenerational. We're currently working on some things here in Austin regarding that. So like I said, you all have to stay tuned. But before we go, Director Bordie, did you want to wrap us up with talking about
You kind of just stole my segue. I mean, Olivia stole all my ideas for ageism, but the segue really is to do what we can as communities to make them more age friendly, to make our older adults, to get them out there in the community and visible and around us. I've been to some places where you're walking on the street every day, or in a community or in a park. There's just as many older adults as younger people, and making sure that we set up our community to be as age friendly as possible, so older adults can participate with ease in all aspects, from social justice to education, to mentoring, to building a community garden, to doing whatever they need to do. And I would love to just see it where it's just not unusual for our younger people and older people to be together, you know, in all of our open spaces. So our age-friendly plan has a lot of those pieces, and I hope all of you on the call will really help participate by, you know, being on one of our work groups, giving us some input, advocating, doing whatever you can. Thanks.
Awesome, awesome. Well, you all have been fantastic. And I want to thank you all for allowing me to be your moderator today. Like I said before, we're going to have these series of forums, and I know they're going to be great, rich conversations. So we invite our guests to definitely sign up for the next one. At this time, we're going to start to take questions, and I'm going to turn it back over to the director of AustinUP, Ms. Therese Ferguson.
Hey, Tabitha, thank you. Great panel. We did have a couple questions already. Someone asked, I think Olivia, in response to your presentation or your answer, what was the organization again? Something about frameworks?
Yes, the Frameworks Institute. And so I put their website into the chat. And specifically, it links to their Reframing Aging Initiative, which is kind of gets into the biases, breaking down stereotypes around aging.
Great, thank you, Olivia. And another question, do you know if there's a way to receive a copy of the survey results on messaging about aging that you mentioned? Not sure who that was for, who that was addressed for. Well, anyway, we can get to that later. If you have questions, feel free to add your questions to the chat box, or you can also unmute yourself. We want these forums to be as interactive as possible, so you can ask your question directly. While we're waiting, I did have one question. You know, when we were creating the Age-Friendly Austin plan, we talked about people, older adults or people who are living longer, healthier lives. And then it seemed like the pandemic hit and older adults were most vulnerable. So where are we now? You know, so is it true, older adults living longer, healthier lives?
I'm going to say it is still true. You know, when we, you know, look at the number of people who, you know, have died in Travis County, you know, yes, we've seen people that were older did die, but we also, you know, saw other ages. I mean, you know, even people in their 20s. And I know a lot of people probably don't understand that or realize that, but there were some folks that were in their 20s that died as a result of COVID. But what I will say though is that you know, hearing from you know, some of the folks that have kind of, you know, sent me cards, you know, that they did go get COVID, they were in the hospital, but they're doing well, and you know, they're elderly people. Hearing from folks that you know, they got the vaccine and they wanted to you know, let me know about their experience at the sites, you know, being at the sites on you know, on days when we had quite a few seniors come through, and just kind of talking and listening to them. You know, one gentleman in particular, you know, I had a very good conversation with him, and you know, he reminded me of my grandfather, and I told him, I said, you know, you remind me of my grandfather. And so, and my grandfather, you know, he's deceased at this point, but he had just kind of same kind of mannerism. And so, you know, for me, it's always a joy and a pleasure, you know, to sit around people, you know, that have lived through some things and they've seen some things and they're still active, and they're like, you know, I'm gonna get my other vaccine when I come back, and you know, I'm going to visit, he said, my great grandchildren. And I thought, oh, that is wonderful. So, you know, I just think that people are living longer. You know, and I know we didn't kind of get a chance to talk about the mental health component, but I really strongly feel like we always need to be thinking about holistic health, our clinical as well as our behavioral health, and making sure that, you know, we know that people were having problems with mental illness before this hit, and it has increased for so many people. And so the supportive system, the counseling and therapy that they may have been going to, and even for those people that may have been taking, medication, I want them to continue to be whole. And if and counseling is what you need to do your counseling. And so we're at a point, safely, you can go have a virtual visit. You can have a telephone visit, or you can now do, a face-to-face visit, where you and your therapist are really safe. But I want people to really not lose sight of making sure that we are really looking at people holistically, and especially with that mental health perspective.
Great point. Excellent. Another question we had, do you have any suggestions about protocols to establish as we start bringing vaccinated groups gradually together? In our case, it would be for exercise classes. Is it acceptable to require proof of vaccination?
Well, some places are saying that they are going to, want to ask folks for proof. And I know that some events are going to say, yeah, I want to be able to see proof. But we know the kind of the governor's stance on that, from a state perspective. I think really the kind of the safest thing at this point is definitely encouraging folks to get that vaccine. We really want them to get it. But in the meantime, we know those safe precautions work. If you're going to do an exercise class, just kind of spread out a little bit, make sure, people are at a distance, and just using those precautions, when people come. But we want people to be active. And so, take temperatures, use your little wand and be able to take the temperature, and kind of like when you go to the physician's office, that, kind of ask those questions, and not that you keep it or log it, but you just really want to know the answers to those questions, just to keep everybody safe. And then lastly, if folks are not feeling well and they show up and, they're sneezing and coughing and, and you're like, excuse me, go ahead and ask those questions, because ultimately, if this is the facility or your class that you're running, you have a responsibility to keep everybody safe. And so, you've got to ask those questions and have people to agree that I'm going to stay home if I'm not feeling well, and I will go get a test, because they're still free for you to have a test, a COVID test.
Good, good. Any other questions?
Teresa, this is Jessica. I have a question going back to something Patty mentioned earlier, and that was, to join an age-friendly work group. And I was wondering if you could speak a little bit about how one might do that if they want to engage more with the Age-Friendly Austin Action Plan. What are some things they can do to do that?
Tabitha, do you want to take that?
Absolutely. I was like, this is all for me. Okay. So as the artist been stated, I'm the City of Austin's Age Friendly Program Coordinator. And actually, as you were speaking, Jessica, I was already typing in my contact information. And so if you all will learn more about the Age Friendly Action Plan or want to know more about our activities, you can also email me and I'll give you that information. I'm also going to provide my telephone number in the chat for those who may not like to use technology. So that way we can have a conversation over the phone. We do meet on a monthly basis. And so we have several different members of our community that sits on those working groups, from nonprofit executives to lay community members and others. And so we would love to have you. We would love to share more about our age-friendly experience with you and how we can continue to stay in contact and collaborate. So I will drop that information in the chat. And just in case you're not looking at that, I'm going to give you my telephone number right now. I can be reached at 512-972-5023. Once again, my name is Tabitha Taylor, and you can feel free to call me, and I would love to speak with you.
Thank you, Tabitha. Very, many cities are part of the age-friendly network, but very few cities have designated an age-friendly program coordinator like Austin has. This is a wonderful thing that Austin has done. Tabitha, you're doing a great job. Director Hayden-Howard. I mean, because this office of the age-friendly program coordinator is under Austin Public Health. And anyway, it's just a great thing for Austin. We're learning a lot from you. And the great thing, I think, the value there is that the city of Austin has, of course, all these different departments, right? And we talked about transportation, housing, et cetera. It really does take one person in the city to coordinate with all the different departments and kind of be there in meetings to raise your hand and say, I'm speaking on behalf of older adults. How is the transportation plan going to address older adults' needs? That's just a wonderful thing. And not all cities have that. So yay for Austin. What else? Other questions? One question, another question came up is funding. You know, right now we have, I know that we expect some federal funds to help us, you know, deal with the rest of the pandemic, to get out of this, to get back to some kind of normal. But will that continue? I mean, I'm thinking that there are innovative ideas. You talked about innovative ideas that will last past this point. Will we be able to fund them, those initiatives?
You know, I think about the funding, you know, that Austin Public Health has, and you know, how we make grants with nonprofit organizations. And our goal is to continue, you know, those grants that we make with individuals that are providing services to seniors. It is really important, you know, from a, you know, social service perspective. And, you know, for me, you know, my background is in social work. And so I really strongly believe that as we work with nonprofits through that grant making experience, you know, they are an extension of the city through that contract. And so through that contracting process, some people are very comfortable with working with a nonprofit. The city can offer a service and a nonprofit can offer it. And to be honest with you, some people are just more comfortable working with that nonprofit and you know, even working, you know, in a kind of a different setting, knowing it's not a bureaucracy. And so so that funding, you know, will continue. It's always contingent upon you know, council approval each year with the budget. But each of them has really really embraced social services and making sure, you know, that we continue to have the ability to make those grants.
That's good. Good to know. Yeah, Patty. Patty, I think you're on mute still. Can't hear you.
Oh, sorry.
There you go.
I'm sorry about that. Can you hear me?
Yes, perfect.
You can?
Yes.
All right. I just want to add one more thing. And one more thing is just, you know, we had that same perspective of, we got this federal funds to really address the pandemic, but every time we made plans, we had in the back of our mind, if this is something really good that's really helpful, how will we be able to sustain it? So as Director Hayden-Howard was saying, we looked at what are our other existing sources? What are our service definitions? What are our plans? Who are our partners in each of our counties? How will we be able to continue these new and innovative and fabulous programs that we were able to create and incubate during the pandemic? So it's always in the back of our mind, you know, and sometimes we're successful at finding some funding to replace that, and sometimes not so much. I mean, we're lucky in this region. We have St. David's Foundation. We have other foundations. We have local community initiatives in some of our other counties that played a key role in the pandemic, and they want to continue to play that role. So it is something we always look at. and keep in mind when we're implementing something new? How does it fit? And that's sort of my role, is to really, how does that fit and how can I keep it going, once we're all back in the world post-pandemic. And that's it.
And I'll just say from a state perspective, so my office specifically, as I mentioned before, doesn't oversee programs that are providing the Older Americans Act services. So we don't have a designated funding stream for the programs and resources that we do produce. And so we have had to be really creative over time with developing things that are free, low cost, and useful for older adults and for communities. And one of those that we implemented as a result of the pandemic was our program called Know Your Neighbor. And so it was created to encourage communities to reach out to each other, the older adults in their lives, whether they be, their neighbor, someone in their church or faith community, and really just sparking kind of people checking in on each other, and to maybe address some of the loneliness and social isolation that was pretty rampant. So we've had a lot of the way it's really web-based. And so for people who don't necessarily have access to technology and broadband, of course, that's an issue we're trying to address, but we created templates and different resources that people can download from our website and use to kind of start those conversations. Maybe you've lived for years next to an older woman, and the extent of your relationship has just been saying hi. Well, we created different prompts and template emails or even written letters that you can use to kind of start that relationship. And so it's just a free kind of really low tech, not even cost effort to address that. And so as things are changing in the pandemic, we're looking at ways to expand this program. And I know that we're always really welcome feedback from our partners. We utilize our Aging Texas Level Advisory Committee for a lot of our projects in our specific office. Patty Bordie is a member on our Aging Texas Well Advisory Committee, so she can attest to how much we use them as kind of a sounding board. And so that's one way, just that we've kind of addressed that funding issue at the state level, developing resources that first can be that are free and can be replicated or changed to fit the community's needs. And then I know federally there is a lot of attention being focused on broadband access and funding around that specifically. I know grant makers in aging, the Foundation for Aging, different kind of nationally recognized philanthropic organizations are looking at funding long-term this issue. And then also the federal communications, FCC, I'm not sure the entire acronym, but that federal entity has a lot of programs related to increasing telehealth access, both for providers and for consumers. And so recently, I think within the next week, they're going to launch their emergency broadband benefit program. And this is for anyone to access. There's some income eligibility requirements, but anyone that's eligible can get up to $50 towards their internet broadband bill. And then they can also, if they don't have access, they can get up to $100 for their to purchase the service. And so I think once they launch that within the next week, there will be more information on how people can sign up, who's eligible. And so I'm happy to find that link and drop it in the chat. And I'm also going to share my contact information as well. So if anyone has further questions about anything that I've talked about, feel free to connect with me. So I just want to kind of say that just on the horizon, I do know, especially in the broadband access arena, that that federally people, we are looking at this, and hopefully, this will continue to happen past pandemic. So thank you.
Thank you, Olivia. That's hopeful information we all need right now. Tabitha, anything else to
Yes,
say?
and sure. If I may, I just want to say on the local level, when we're talking about internet access, our own Austin Public Library has been doing some very great things to partner with our older adult community. Not only have they been providing technology devices, but also they have been providing hotspots for older adults. And so I think I saw Emmy Johnson there in the audience somewhere, but just want to give a thank you to them, a very special thank you. And if you know someone in need that may need a hotspot or a technology device, please do contact me. Also wanted to share that the Aging Services Council, they're also putting forth many pilots to support older adults with technology as well. So I just wanted to make sure that we did share that with our audience.
Thank you, Tabitha. All right. Well, I think we'll wrap up this session so that we can get ready for our next session, part of this forum. So thank you, panel. Thank you, Tabitha. That was wonderful. Lots of good information. And so, like we said, we will be adding information to and links into the chat box. You can save the chat file via Zoom. I think you can, there are 3 dots at the bottom. You can say save the chat so that you can keep the resources that you learned about today during the session. So while we are getting set up for our next session, if you all stay here, maybe go get some water, take a drink. You have a few minutes till we start. But if you're sitting at your computer, in the chat box, give me a couple words. What does age-friendly mean to you? When we talk about becoming an age-friendly city, creating an age-friendly city, what does that mean for you? All right, thanks everybody. Be right back. All right, we'll get started in about 2 minutes, 2:15. I have to share this. Age friendly for me means building a city for all ages to actively participate in their community and have access to resources to enable everyone to age successfully. Yes, yes. And we've only just begun. We have so much work to do. All right. So for our next session, I'm very excited to, it's titled Age Friendly Austin, Our Vision for the Future of Aging. Very excited about this panel, but to introduce our key speaker, I want to introduce Jessica Lemon. She's the Associate State Director of Outreach and Advocacy for AARP Texas. Jessica.
Hello, everyone. It is my great pleasure to introduce my AARP colleague, Danielle Arigoni. Danielle is Director of Livable Communities at AARP, where she works to support AARP's 53 state offices, including the District of Columbia, U.S. Virgin Islands, and Puerto Rico, and more than 500 localities in several states enrolled in the AARP network of age-friendly states and communities to create great places for all people of all ages. Danielle leads the team responsible for supporting the age-friendly network members, developing free practitioner-focused publications on topics ranging from accessory dwelling units to placemaking to rural livability, and delivering direct technical assistance to nearly 100 communities each year. Her team also disseminates a free weekly newsletter on livable communities-related issues, reaching more than 100,000 local leaders around the country. Danielle is an urban planner by education and has more than 20 years of professional experience contributing to more sustainable and resilient federal, state, and local policy, including prior leadership positions at US EPA and HUD. She also serves as a board member for the League of American Bicyclists. Danielle holds a master's degree in regional planning from Cornell University and a bachelor's degree in planning from the University of Oregon. And thank you so much, Danielle, for joining us today to really share a national perspective, and hopefully we can drill that down to what that means for Austin. So I will turn it over to you.
Thank you so much, Jessica. Thank you, Teresa. Thanks to my colleagues, both present and former, who I understand are on the call here today. So really excited to be here. I love being able to sort of come in and touch base with age-friendly efforts that are on the ground, that are underway, because we lean on you all so much to learn how this work actually happens at the local level. And I think there are a few places that I think can tell as great a story as you all can in terms of what this work has really delivered for the people of Austin and for your community as a whole. So really grateful to be a part of your conversation today. I'm going to go ahead and share my slides. And just kind of, yeah, as Jessica mentioned, just kind of give an overview of what's going on across the country and how the great work that you all are doing in Austin fits in. So I, just out of habit now, I can't not start with this slide because the way I really think about this work as unfolding, so I'm having a difficult time getting it going, not sure why. My PowerPoint seems to have frozen. Can you all see the main slide there? Even if you can see the stuff along the side?
Yes, we can see that.
I don't know, I'm not, my computer seems to have frozen altogether. Did you want to project from your side?
Yeah, I can show.
That would be perfect. Okay, I'll start talking, but if you can tee it up on your side, that would be great. The slide you'll see in a second starts with our demographics. And the reason I always start there is because for us at AARP, that really kind of, I think, drives why we do this work. We know that by 2034, we will be a country comprised more of older adults than of youth for the first time in our country's history. And that's, again, this demographic tipping point that we've not previously experienced as a country. In which we will be comprised, again, of a lot more older adults even than we have today. And in the case of Austin, there's a significant senior population, but even in Texas, thank you so much, Teresa, we're seeing that the rates of growth among 65 plus Texans has more than tripled. There's expected to more than triple in size from 2010 to 2050, approaching 8 million people. In fact, the work that you all are doing is not only anticipating that, but it's anticipating the next fastest growing age cohort, which is 45 to 64. So you're really covering the gamut of people 45 and above as being the fastest growing groups in Texas. And that really, I think, certainly calls us in the United States to ask the question, are we building communities? Oh, I'm sorry, next slide, please. To ask the question, are we building communities that are ready for that future? And arguably, we're not. If you look at the statistics on how things are going now, it's pretty fair to say that the most communities are not being well served. The needs of older adults are not being well served by the decisions that are being made at the local level at present. So when we think about housing, for example, we know that there's a real mismatch in the type of housing product that exists and who we are as a country. We're comprised of about 50%. Yeah.
Wait just a minute. I'm having trouble advancing the slides and hosting the event too.
No worries. I apologize for my computer glitching out here. But I'll keep going. Yeah, I think, when you think about housing, you think about how many households we are these days of 1 or 2 person households. Actually, more than half of our households are 1 or 2 person households. And yet 85% of our housing stock across the US is 2, 3, 4 or more bedrooms. When you think about affordability, we know that affordable housing is a crisis everywhere. I think it's particularly a crisis there in Austin, and it's particularly a crisis for older renters, where we see that the number of rent burdened people over the age of 65, that is people who are spending more than 30% of their income on housing, is growing. We are seeing upticks in the number of homeless, people experiencing homelessness who are older adults as a byproduct of that lack of affordability. We also see that there's a real lack of accessible housing. Thank you, Teresa. That there's less than 1% of our housing stock is comprised of housing that has accessibility features or that would allow for people to age in place while having, adaptive environments that suit their needs. When you think about public spaces, it's a similar dynamic. We're not building public spaces that are inclusive enough or welcoming enough or dynamic enough or safe enough that really meet the needs of older adults. And that's reflected in the fact that a recent RAND study of major urban areas said that even while 20% of the population around the park is older adults, only 4% of park users are older adults. And we also know, of course, that parks are not equitably distributed across our communities, that communities of color parks tend to be much smaller, often half the size, and much more crowded than in other communities. And when you have a lack of green space, that contributes to more localized heat effects, which contributes to health effects that are particularly acute on older adults. So really, these things all roll up to some very serious conditions. Next slide, please. Similarly in transportation, and I know that this was some of the work that you all focused on age-friendly Austin, but we know that older adults outlive their ability to drive by 7 to 10 years. And so if we're not creating places that are safe for people to walk, where there aren't sidewalks or are inadequate sidewalks, then we really are eliminating mobility options for people. Public transit systems across the country are really in crisis. There may be some hope on the horizon in terms of federal funds flowing, but we still have seen really rapid drop-offs in terms of ridership, in terms of routes and schedules, such that people who rely on public transit, either for economic reasons or for ability reasons, disability reasons, or for lifestyle reasons, cannot access that mobility the way that they once could. And sadly too, we're also in the worst decade of bike and ped fatalities that really has been consistently rising over the last decade. And in fact, the worst year for bike ped fatalities was 2018, 2019, the last years that we have on data, good solid data for. And that older adults represent a disproportionate share of that population in 35 states. So arguably the transportation world is not treating older adults very well. And again, all of these things roll up to a sense of, can roll up to a sense of isolation and prolonged loneliness if in fact, housing is not supportive and healthy and allowing you to live your best life. If you do not have transportation options that let you get outside the house, if you're not close to or can access public spaces where you can go and recreate and socialize and all of that. And when people experience prolonged isolation and loneliness, that too has very real health effects, equivalent to smoking 15 cigarettes a day. And we now know too that isolation is associated with an increased risk in dementia. So all of these built environment components and elements roll up to a pretty severe health crisis, frankly, for older adults today. And if we don't do things differently, that crisis is going to expand, it's going to worsen, it's going to affect more people. Next slide, please. So that's really why we're doing this work. That's why AARP is so invested in our livable communities work, and why we are honored really to be able to work with and support local leaders like you all to help you think differently about all those myriad choices that get made every single day at the local level, how we design and maintain and ensure that housing is affordable, how we ensure transportation options are available, how we design and manage and activate public spaces, so that we're truly creating great places that work for people of all ages. We do this in a few different ways. You all know well our framework for age-friendly policy investments. So I'll just kind of talk about that from a national perspective. And then I hope that you already know about many of our other resources, which I'll touch on over the course of the talk as well. Next slide, please. So obviously our age-friendly work, so I'll start with the stuff that perhaps is newer, and I'll end with our age-friendly work. So one of the ways in which we do directly get engaged in local actions is through our Community Challenge Grant program. And while you are all familiar with the age-friendly program, and we'll get into that in a little bit, that's a multi-year commitment. That takes a lot of time. You all have been at it for several years. These Community Challenge Grants are meant to sort of augment that. With some really targeted, quick action strategic investments to help localities build the case for why this kind of change is needed. So Austin has been the site of some really creative, beautiful artwork and mural work that has helped to activate space, to draw attention to the needs of slowing traffic and improving the quality of the pedestrian environment. And that is one of hundreds of such grants that have taken place across the country. In the last 4 years, we've awarded more than $6 million, and we're on track to award another probably a couple $1 million this year. Our period for the challenge grants has closed. We'll make announcements June, July timeframe. But the reason that these grants are so important is because, it really helps us help you in the locality to demonstrate the value of a different way of thinking, to re-envision how a particular public space has been used, or to demonstrate why a bike lane in this particular neighborhood would serve a purpose, or to demonstrate how and why accessible seating is needed, or accessible picnic tables are valuable in a public space, so that we can really activate that park for more people of more ages, more abilities. Next slide, please. Another one of the tools and resources, sets of resources that we offer is a lot of online resources. I hope that you're familiar with our Livability Index, which we are really pleased to have just announced. We are partnering actually with the National Association of Realtors, so that our Livability Index is now integrated into the proprietary search engine that realtors run, so that realtors can make good use of that data when they're helping to look for homes. But I think for the purposes of you all and local leaders, the Livability Index is a great way to sort of assess where your community is at now, what you're doing well at, and what are some areas that can be improved upon. As you know, it maps 60 different metrics and indicators that really give a relative score for how livable the community is. Again, it's a great starting point for the work that continues that you all have been doing. Another more recent tool that you might be less familiar with is our searchable map, which lets you look for other age-friendly communities and other community challenge grantees around the state, around the country, by topic, by population size. So there's a wealth of information there. And then of course, our weekly newsletter, which I hope you all receive. If you don't, I'd encourage you to sign up. Every week we send out new information for practitioners, for local leaders on the kinds of topics that will help you do your job better. We try to connect the dots between what communities across the country are doing and share with you new resources and opportunities that we learned about from our national partners. Next slide, please. And I'm really very proud of our sort of our livable library, as we like to call it, the publications that we've offered. So I would like to believe that some of these have been helpful to you in your work so far. And if not, I hope you I would encourage you to look at them and consider that in your work. They touch on all the things that you talk about in your action plan. Certainly walkability is a big part of what you all are concerned about, and it's a big part of what we're concerned about. So our walk audit tools, for example, let you lead community walks. And even these days when we're not walking in groups, we've developed, with the help of my AARP Texas colleagues there, Chandra Weigel in particular, we've developed walk audit worksheets that you can print off at home and go out independently, walk around your neighborhood and assess and figure out what needs to be improved about your pedestrian environment to make it safer, so that you know what to advocate for with your local leaders. Similarly, the home modification work that you all talked about in the action plan, our home fit guide, I think can and can be very helpful in making the case for in some cases very easy fixes within the home, in some cases larger investments and wider doorways and wider hallways. But all of these fixes that we talk about, and there's more than 140 of them in our new renovated, refreshed home fit guide, are designed with the idea that we can make changes now to make our home better for all people of all ages, all abilities. We don't need to wait for the time when we have mobility impairments. We don't need to wait for the day when, God forbid, we break our leg in a ski accident. By thinking differently about our homes now, we make them more inclusive, more visitable, more safe and comfortable for people of all ages and all abilities. So we offer those resources in 5 different languages. And again, really encourage you to check those things out among the other topics that we cover. Next slide, please. So finally, the real heart of the matter here is our age-friendly network, of which you all are such an important part. You're one of more than 500 communities now that are working on this multi-year process. And as you know, it's not easy work. This takes a lot of time. It takes a lot of people, a lot of stakeholders involved, a lot of big and small decisions all along the way, a lot of listening, a lot of creativity. And we know that it has been a really impactful and powerful way to demonstrate the value of thinking about things from a different perspective, so that we are actually supporting the creation of places that are more age-friendly. We're pleased to say that more than 100 million people now live in a community that is committed to become an age-friendly place. Of course, there's a lot of work to be done, a lot more millions of community members that we need to try and reach, but this is a pretty impressive body of work that we've been able to really learn from as it's unfolded. Next slide, please. And part of what we've learned is that, these 8 domains that I think serve as such a wonderful starting point have proven to be very malleable and nimble and flexible as we've sort of confronted changing needs over time. So, the sort of standard issue, areas of housing, outdoor spaces, transportation, we've always known those are important. How we design our built environment has very real effects on our health and our well-being. But we've really learned in I would say in the last year, the importance of things like communication and information and social participation. Turns out that those domains are as important to our health and well-being as just about anything else. If people aren't getting the information that they need about where to get a vaccine, how to sign up for a vaccine, how to get food delivered, in the early days of COVID, then all the other stuff is kind of for naught. So this age-friendly framework has really proven to be very, very adaptable and very flexible, reflecting the needs of the challenges of the day. Next slide, please. And we've been pleased to be able to sort of showcase that. We did a couple different series of age-friendly leaders that we handpicked from around the country. Early on, we talked about how a handful of age-friendly communities responded to COVID-19 and some of the very creative and sort of quick thinking that was in place there in terms of how they adapted their services, how they put in place phone banks or food delivery systems, or pivoted to online social programming, which now seems par for the course, but back in the day it was novel. Our age-friendly leaders really demonstrated that focused attention on older adults made the difference. It helped improve and ensure the quality of life for people in the early days of COVID. More recently, we've focused on equity and the degree to which our age-friendly communities are targeting equity and supporting that work. And Austin really emerged as a leader in that respect, particularly from your ability to sort of design and implement culturally relevant programming, among other things. And so again, there are a series of stories on each of those topics on our website. Next slide, please. But one of the things that we learned and that we recognized in sort of the body of work around equity was that our age-friendly leaders really were focused on empowering adults to sort of impact the outcomes in their communities. And that by doing that in a targeted way, for example, in Wilton Manors, Florida, where it was a very large LGBTQ population, that really sort of gave the LGBT community a louder voice, an appropriately louder voice in their community to shape the kind of outcomes and ensure that they had the sort of conditions in place so that they were allowed to live their best lives, ensuring that caregivers in same-sex partners had the same rights, for example. We already talked about the importance of culturally distinctive programming. And again, Austin was a real shining star in that. We've seen that age-friendly programs invest in really in targeted and trusted partnerships. It's oftentimes the best messenger or the best way to reach hard to reach populations isn't through the city manager's office or the city council. It might be through that local church or through the the social group that gets together, or the mahjong group. And so knowing what those targeted groups are so that you could bring folks into the process, it became and proved to be very important element of ensuring that age-friendly work was achieving equitable outcomes. Similarly, other age-friendly communities really use data to drive to drive investment in places that they had identified as being underserved. So if a part of the community was underserved in transit, or underserved in groceries, access to fresh food, or underserved in information or access to social events, that drove the age-friendly work to sort of equalize and level those inequities out. So we were really pleased to see what we learned through the course of our age-friendly work around the country. And again, pleased to see Austin among the leaders there. Next slide, please. So a couple other communities to sort of shine a spotlight on. I'm not going to say they're your peers because Austin stands alone, but other communities that are doing great work too. One is Miami-Dade County in Florida, which has been an age-friendly member for a few years. They, like you all, really honed in on transportation and on pedestrian safety and access, improving walkability. And they did that particularly by looking at where older adults were, what their needs were, and how they could support better access in those particular communities. One of the examples of how they did that was by going after and securing a challenge grant, actually, which allowed them to respond to a need that they had heard from older adults in the Little Havana neighborhood, which were higher users of public transit, but still identified barriers to using public transit because of lack of seating, lack of shading, lack of comfort features that would make public transit, available, no question, or easier to use. So they invested in these age-friendly benches that they installed along this particular corridor as an example of what it means to really think differently about communities from an age-friendly perspective. So really celebrate that leadership. That's just one example of the kind of fantastic work they've been doing for several years now around equity, around safe streets, and much more. Next slide, please. Another community that we lift up often that's done great work is Columbus, Ohio, which has been, again, at this work for a while too. They've also done some very creative work in transportation. As a result of their age-friendly work, they got 2 new neighborhood circulator buses up and running. They actually conducted with the Ohio Department of Transportation a Safe Routes to Age in Place study, which is kind of a close cousin to the Safe Routes to School study, but with the needs of older adults in mind. They implemented a mainstream on-demand mobility service for paratransit. But one of the things that I love in particular is this Lifting Villages program, where I think they were able to pair the value of the Village program, which, as you know, is a member-driven, hyper-local, sort of volunteer-driven organization. It's a way to augment people's ability to age in place by providing some basic services, basic transportation, grocery delivery, some light home repair, things like that. Villages are powered by volunteers, and as much as they like being able to offer volunteer rides to village members, sometimes there aren't enough volunteers to make those trips. So they actually connected the village with Lyft and have it such that when a volunteer driver is not available, those calls directly get rerouted to Lyft, who've already been trained on how to service older adults in the region. And it keeps the need for older adults away. They don't have to use a smartphone to access those services. They can go through the village, which is a known entity, very consumer, customer service oriented. So again, just finding solutions like that and being able to implement them, I think is exactly what this age-friendly approach is all about. Next slide, please. Finally, this work is not just happening at the local level, and we've had a number of states join our network. Texas is not among them yet, but Maine is. And one of the reasons I think Maine is so fantastic to talk about is not only because Maine as a whole has a huge number of age-friendly communities. I think it's upwards of 70 now. But Maine is also one of the first out of the gate to move very quickly from joining our network to actually putting in place an action plan that is really going to drive how the whole state legislative structure, this whole state government, moves to better support age-friendly work at the state level. So they used an interesting approach of, in doing their community listening, they kind of captured what they heard, what they have in place now that serves the needs of older adults, and what they commit to do differently. And some of those goals that they articulated as a state on behalf of older adults is, increasing meaningful volunteer and community service opportunities, strengthen this notion that there's no wrong door to get services. I mean, I think they must have heard that often, that it's difficult to access the right services if you don't know where to go. They're going to fix that through their efforts. Support increase in broadband coverage. I know we talked about that in the last session, the importance of that. Expand the availability of accessible, affordable multifamily housing, particularly coordinated with services. Increase volunteer driver organizations and support for those. And support for policies and programs that create non-motorized ways to get around in the form of ADA compliant sidewalks and crossings. So those are just a few of the many, many goals that they articulated. But again, I think it speaks to the sort of maturity of this work, the fact that it's really become appropriate and in fact desirable for states to tackle work at that level in ways that support local efforts downstream. Next slide, please. And again, I think it's because of that, it's hard to know which drove which, but in tandem with that kind of growth, we're seeing that there's a greater awareness now at the national level and at the international level in terms of the needs of older adults and how that fits in. I think we can draw a direct line between the leadership of Maine and Senator Collins, who sits on the committee for that authorized the Older Americans Act, and the fact that the Older Americans Act now in its final reauthorization language last year actually cited age-friendly communities for the first time ever. They created a new committee on healthy aging and age-friendly communities, and they recognized that the importance of age-friendly communities in creating this comprehensive web and network to support older adults. So I think we can draw some direct ties there between Senator Collins's leadership and what she has seen be so effective in Maine. Internationally, our age-friendly work is ultimately rooted really in the United Nations and the World Health Organization, who knew from global partners all around the world that it was critical to set up a framework for creating communities that were going to allow people to age in place better. Even more so now, we are just at the beginning of a decade-long focus, the decade of healthy aging, which is going to sort of further drive this discussion at a global level in terms of what it is we can do to create communities, to create places that better support older adults. Next slide, please. And finally, I'm very bullish on where things are going in terms of what, kinds of opportunities might be coming down the pike with the new infrastructure plan, with the emergency broadband benefit. There's a lot of things kind of percolating at the federal level that I think are very much in tandem and in support of the work that you all have already been doing at the local level. So for example, you all have talked about the importance of sidewalks and increasing options. And we know that the American Jobs Plan talks about how can we support better bike and ped infrastructure. It talks about how we can expand and modernize our transit. You all have focused on the needs of housing and diversifying housing and making it more affordable. So too does the American Jobs Plan point to work that will be supported at the local to sort of tear down those zoning barriers that get in the way of creating more housing options. Things like, repairing and connecting communities by taking down highways that have been divisive and obtrusive. Again, more support for high-speed internet access. The whole list of things that the American Jobs Plan includes. Again, there's a long way to go before this becomes real, but the point is that all of this work that's being envisioned in some ways reads like an action plan. It reads like the kinds of supports that communities, you all have identified that are needed in order to create places that really work better for older adults. So I'm here to sort of tip a hat to the good work that you all have done. The fact that you have a full-time age-friendly coordinator is amazing. The fact that you have been integrated wholly into the Imagine Austin Comprehensive Plan is amazing. You all are doing great work, and we're so pleased to be able to support you and to learn from you. Next slide, please. And I think that's the end of my bit.
All right, Teresa, do you want me to take it from here?
Yeah, sorry, I was just going to make you put your spotlight, Janee. So hold on 1 minute. All right. So as you might expect, we have some questions, some very focused questions for Danielle. And to ask those questions, we've invited Janee Briesemeister to be our moderator for this part of the conversation. Janee is the chair of the City of Austin Commission on Seniors. Janee, now take it away.
Thanks, Teresa. And thank you, Danielle, for your presentation. It is so helpful for us to hear about what's going on across the country, and so exciting to hear about the innovations that other age-friendly communities are implementing. And we look forward to looking at how we can implement some of those here. And we're so appreciative of AARP's resources, which we lead on quite heavily developing the plan and now in implementing it. And of course, the AARP Texas office has been a great partner for the commission and the city. And of course, Teresa Ferguson, equally so in us both developing and implementing the plan. And as you mentioned, and it has been said earlier, Austin has just made tremendous progress since I think back to when we started working on the plan in 2015 and ultimately got it approved by council and incorporated into Imagine Austin in 2016. And then getting Tabitha Taylor, the age-friendly program coordinator, hired has just been great strides. But still, there's still work to do. And I think about park benches. And you had some pictures with park benches in, and late last year we asked the Parks Board, one of our boards and commissions here, to support our effort to have more seating in parks and trails and open spaces, which is one of the age-friendly plan issues. And of course, they were very, very supportive, but several of the members said to me at the time that, oh, we're so glad you brought this to us because we realized we just haven't been thinking about older adults very much on this board. And while we have a really good relationship with the Parks Department ourselves, the board does do a lot to set policy. So, so my question is, based on your experience with other age-friendly communities, can you give us some advice on how else we can promote Austin's age-friendly efforts and to get our ideas and our goals integrated across the city?
Yeah, and I think, you know, benches is a perfect example in many ways. It's that thing that once you sort of give age-friendly work an image and a picture of what we mean by age-friendly work. I think the question Teresa asked before, what does being an age-friendly community mean to you? I mean, it's conceptually, we understand what it means to be a place for all ages, but you don't really understand what gaps exist until you can sort of bring it to life. And I think the benches is a perfect example. You know, if we can make the case that, you know, these trails will be more accessible by older adults if you provide a bench every X number of feet or, you know, or yards, whatever. That's the gap right now. We hear that from older adults. We've done surveys. We've seen it. We've seen other communities that have invested in benches and look at the sort of use figures that result from that. I think the more that we can make these investments and these concepts very tangible, the better chance that we have of getting them done. And I think part of that is bringing those unconventional partners to the table. I mean, you know, maybe it's not just talking to the parks folks, maybe it's also talking to public works and, you know, running groups and even, you know, sort of walking groups and other folks out there who maybe don't feel that they're part of the process in that directive way, but certainly see how they could stand to benefit from a service that was more suited to their needs. I'm thinking of a community in Louisiana, for example, where there was a senior center and a park, maybe a block away, really close, but there was no sidewalk between the two. And so the senior center, they would go out, the residents of the senior center, the visitors to the senior center would walk in the parking lot. They'd walk in circles around the parking lot because there was not a sidewalk to get to the park. And so that became like the focus of that town. Like, we are going to connect those older adults in that senior center to that park. And that became the sort of thing that brought the concept to life. And I think the more that we can point out those gaps, see how they can be fixed and filled. And that's the kind of thing that I think can build momentum for further change.
Thanks. And I love your suggestion about unconventional partners. One of the suggestions we made with the park benches is we have something here called memorial benches, but only in a few of the big parks. And we suggested expanding that, not just having them be memorial benches, just sponsored benches. It's a great way to get more benches out there and, you know, promote a group or recognize someone.
Exactly. Yeah. One of the story that I refer to all the time, or the video I show often, is another community challenge grant. I know Jessica put in the chat here that Austin received a challenge grant in 2020, which is wonderful. Another grantee was Boston, either 2019 or 2020, and they actually they received a grant for their what they call their age-friendly bench program because they had actually done a bench audit. They actually surveyed different parts of the city, and this goes back to equity, really. Finding out where communities are underserved, where there is more of something than there is in other parts of the city, and then seeking to sort of you know, make that resource more available. And what they heard from residents is when they focused on parts of the city that were woefully underserved in park benches, and we just mean benches along the sidewalk, places to sit and rest, that sort of galvanized community members. It created an informal place for people to congregate, socialize, that it drew people out of their homes and into communities in ways that they had never imagined. And they picked one area to target with this community challenge grant program as a way to test and build the case for doing that in other areas around the city. So start small, start targeted, demonstrate the value of that investment, and then make the case for doing more elsewhere.
Thanks. And you mentioned equity, and equity is it's both a challenge and an opportunity here in Austin. It's something that we've really been focusing on as a city, city government, and on our commission. And we work very closely with other commissions that represent other populations in Austin. But you know, what kind of suggestions do you have for designing the city, you know, implementing the age-friendly plan and design innovations that are accessible to everyone, not just in like the major large parks or the downtown area of the city? And so you just gave one example. Do you have others?
Well, I think, you know, back thinking to the day, hopefully when we're able to come together again in person. I think, you know, community events, block parties, things like that, you know, pop-up placemaking is a really great and inexpensive way to get people out and involved. What we've seen, again, I'm thinking of a community in Maine now that, you know, decided there was a sort of a corner store, a little small commercial area in a town that had seen increases in crime. It was adjacent to a park, increases in crime. The buildings were starting to become vacant, businesses were starting to close, but people in the area really remembered the day when that had been a vibrant commercial corridor, remembered the day when they would use the park and felt safe there. So they recognized that part of fixing that was getting more eyes on the street, getting businesses back in that commercial corridor. And so they, you know, hatched the plan to do some pop-up placemaking. They had kind of a Saturday where they were going to do some temporary sidewalks. They were going to put a hot dog vendor or something like that in one of the vacant stores, a pop-up bakery, maybe it was, and remind people of what it was like when that community was more active. It brought people out. It was very engaging. And, you know, that kind of like small effort, it doesn't have to be expensive. It doesn't have to be permanent. It doesn't have to be, you know, 8 months in the planning, can really make the difference. I think half the time what we suffer from is just a lack of imagination. It's hard to imagine that block being anything other than what it is now. It's hard to imagine that intersection being anything better than what it is now. It's hard to imagine that house being any, you know, in any better condition, or this neighborhood being in any different condition than it is now. It feels so insurmountable. So I think finding those kind of temporary opportunities even to help people imagine something different, and a lot can be achieved with some, you know, sidewalk chalk and some crosswalk paint and some food and some music, and that kind of event I think can go a long way, and that really can be brought to every part of the community, because in doing that, it lets that part of the community celebrate what makes that part of the community unique. It brings out the local, the flavor, the traditions, the sort of languages, the food traditions. It allows for those hyper local events to reflect who lives there. And I think that again is what makes communities so beautiful.
Thanks. Yeah, in addition to equity, I think another challenge we have here in Austin sometimes is perception, of the perception versus the data. And you've mentioned, and we talk about all the time, that Austin has got one of the fastest growing populations of older people of any metropolitan area in the country. Mm-hmm. Yet Austin has a reputation of being like young and hip. Mm-hmm. I like to point out that probably the most famous person in Austin is 80-something years old, Willie Nelson. But still, you know, sometimes there's this disconnect between, Austin, like there's old people there, versus the fact of it. And then we've got the millennial group, you know, is starting to turn 40. So, you know, what are your ideas for involving the younger generation in this effort?
I mean, I think that the kind of event I just described is the perfect thing to bring people together. And, you know, whether it's, you know, musicians or, you know, pop-up, you know, new businesses that are starting to cater or, you know, event planning or whatever, that's an opportunity, I think, to really engage people of all ages, to engage small businesses, to engage, you know, makers who sell crafts or who are looking for small inexpensive places to work and sell their wares. Like those kinds of opportunities can, I think, naturally include, you know, people of all ages and younger folks. But I think too, you know, there is, to your point, Janee, a misperception of what it means to be an older adult. I mean, I think one of the things I'm really proud that AARP does really well is this whole notion of we try to disrupt the notion of aging. You'll see if you're watching the Oscars on Sunday night, I'm told that there will be a new ad that comes out that will make that point very beautifully. And one of the things that stood out to me is like, it shows a skateboarder at a skate park who's in his 60s. I mean, like, you know, people do everything at every age now. And so I think, you know, we know that older adults start our businesses more often than younger folks, that higher rates of entrepreneurship among older adults. We know that older adults are incredible sources of volunteer contributions. We know that older adults wield incredible local political power. They're often the ones who decide local elections. So I think, you know, the fact that we can really use the age-friendly process to disrupt this concept of older adults as being needy, as being frail, as being vulnerable. It's not to say there aren't those older adults who aren't that and who need that kind of support, and that's true, and that has to be part of our approach. But that's not what we mean by older adults as a whole. It's a much more, you know, diverse, eclectic demographic than older adults are given credit for. And so I think, you know, doing those kinds of community events where people are able to look eye to eye and work with one another collaboratively across the age spectrum, I think really goes a long way to changing that perception too.
You know, disrupting aging, that's to me, that's really about, you know, fighting ageism.
Mm-hmm.
And you know, we've in the last few years have had nationally and locally as well more of a dialogue about diversity and inclusion. And we have made an effort from our commission to include older adults in that conversation, that being older is part of the diverse populations that we're talking about. So I'm wondering if you have any, also from what you've seen in other communities, any suggestions along that line about how to include age in the diversity conversation in a way that respects and also amplifies the needs of other communities and communities of color.
I think that is the tension. I think, you know, I remember attending a meeting, the Equity Summit led by PolicyLink, which is a national exemplar of equity-based work, equity leadership, a few years ago, and it was an incredibly inclusive event. I mean, the narrative and the language and the content of equity was so rich, but older adults were never mentioned. And it struck me so much that there are lanes I think that equity tends to fall in that it do not include older adults. I say that with a little bit of hesitation, because I don't want to diminish the important and critical story that exists around the need to achieve racial equity and equity for socioeconomic reasons and abilities. I mean, all of these things are important, and it's not that one is more important than the other, but I think to your point, Janee, they are all subparts of one another. I mean, when you're talking about racial equity, we're talking about older adults, people of color who experience the double, triple, quadruple burden of, you know, lack of access, of perhaps language barriers, of perhaps lack of social connection. So hopefully the more that we become aware, the more that we put the needs of older adults front and center, it helps us get to those multiple layers in ways that let us take action, because ultimately that's what this is all about, is how can we put in place policies and take steps to mitigate that and to really create a more just society.
Teresa, is it me or
Janee, yeah, we can still see you.
I can't. Danielle just kind of stopped in front.
Oh, I finished answering my question.
Oh, okay. Okay. My computer must have glitched a little bit. So along that lines, I'd like to just take a moment and brag on Austin just for a second. So we have something here in city government called the Joint Inclusion Committee, and it is made up of representatives of a number of other commissions, which includes our commission, the Commission on Seniors, the LGBTQ Commission, African American, Asian American, people with disabilities, Commission for Women, Immigrant Affairs, the Children's Commission. So we have these different populations coming together at the commission level, and we have come a long way in expanding and our efforts and uplifting each other. And I think that committee has it's made a tremendous good for all of us in building some of those bridges that you were talking about.
That's great.
So my last question is kind of it's like the nitty gritty nuts and bolts with age friendly. As I mentioned, we started working on the plan in 2015 and it was adopted by our council in 2016. And today in 2021, and especially last year with the pandemic, we look at it and we're like, boy, we really did miss a few things, or we wish we would have worded this differently. And then layered on top of that is that our city has, since we passed that, they've developed their own strategic plan, and it kind of goes together, but kind of not. And, you know, departments we're asking them to collect data for us, but then they have to collect it slightly differently for this other plan. And so, you know, what have you seen other cities do as we're trying to evolve these plans, both in terms of the goals, like I wish I'd known that, and then just the nitty gritty of working with your departments to get data?
I would say that the barriers or the things that you're experiencing are not unique. I think that we all, what's the Maya Angelou quote? Like, I do the best I can with what I knew then, and now, you know, I do better. I totally botched that, but you know the point. I think that's why this process, I think, is kind of a never-ending one. That you know, we now know that we need to be more specific, more refined, more targeted in some of our goals than we did maybe when we wrote plans 5 years ago, and that's okay. I think what we're seeing in terms of you know, what other communities are doing, certainly a number of them, I think, took a little bit of a hiatus during COVID. I mean, I think particularly for city departments that were, you know, really against the ropes financially, it was very hard to do anything other than the most basic work. So that's somewhat to be expected. At the same time, we saw age-friendly communities really make great strides in terms of social engagement, in terms of information and communication with members, that then they might have done otherwise. So in some ways slowed down, in some ways accelerated because of COVID. You know, I would like to believe that the work of the age-friendly world really proved its mettle in the times of COVID-19 and the ability to keep older adults informed, engaged, healthy, safe, and that emerging out of that, hopefully city departments, elected officials, stakeholders recognize the value of that approach such that that work becomes easier going forward, that there's more of a recognition of how critical it is. The only other thing I would say is that, you know, I think it's really important to celebrate successes along the way. And I think especially when you've been at this work for 5 years, as you have, making sure that you're taking times like this, you know, series and other events to bring those city departments back together, to celebrate victories, to, you know, recognize the contributions of departments, particularly those unconventional ones or unconventional partners along the way. Just don't fail to take the time to celebrate the successes along the way, because that's the kind of fuel, I think, to keep the momentum going.
Thank you. Teresa, is it time to take questions from the group?
Yes, definitely.
All right, I'll pass the baton to you. Thank you so much, Danielle.
Yeah, thanks, Janee.
Thanks, Danielle, and thank you, Janee. So if you have questions for either Danielle from the national perspective or Janee from the local perspective about age-friendly, please put your question in the chat box or just unmute yourself and ask the question. It's all good. Any questions? I'm not seeing any raised hands.
I just want to say, Danielle, I love your hopefulness.
Thank you.
And you run for president one day.
I'll say I'm hopeful because of all the work that I see happening in communities. I mean that legitimately and 100%. I mean, it's, how can you not be hopeful when you see groups like this come together and do the kind of work that you all do? Like, it does give me hope for the future, for sure.
For sure. You know, we talk about the 8 domains of livability and the age-friendly Austin plan, but then, and I know the UN is addressing ageism, but that's kind of in another bucket sometimes, you know, where it comes from even internally, our own selves talking ageist thoughts. But do you have any thoughts about that, how can we get past this?
Yeah, no, I think it's a good point. I hadn't thought about it in that way before, that, you know, I mean, obviously ageism is coming from sort of a negative stance, but when I think about the work of age-friendly communities, I don't think about them being primarily organized to combat ageism. It's almost like that's a a mosquito out here that they're flapping away. Their real work is on creating the kind of communities that are going to let people live their best lives. So it's a much more, I think, forward-looking, positive orientation, recognizing that there are real barriers in the form of ageism, and particularly in terms of, gaining employment and, housing policy, things like that. So, but I do think that in general, age-friendly work tends to be a little bit more positive, forward-looking, proactive, and along the way, it does address the issues of ageism as well.
Right. Barry, do you have a question?
Yes, I do, for Danielle. Danielle, we all deal, and particularly in the light of COVID, we deal with, at least for our older population, social isolation. It's across the country, across the world, I guess, to some extent. I've read some things that are positive about, in light of COVID, there's been some people, young people, older people, who've been doing phone calls on a regular basis. What is the national literature, or is there anything saying about that? Is that something that, and I'm not trying to say that takes the place of getting a person out and about. I'm not trying to say that. But it is something that sometimes may be helpful, and is that something as a community we ought to think about continuing to be able to sustain or even expand?
Yeah.
What's your thoughts on that?
Yeah, I mean, what I hear in your question, Barry, is sort of I don't want to say silver lining, but what are the positive things that we've seen in COVID that we hope will continue? And I do think that those sort of purposeful connections between members of the community and older adults, whether that's through a sort of, friendly voice program, a friendly phone call program, or whether it's through kind of a check-in mentorship program when older adults, checking in with a child or a youth on homework or some other matters. I think those are the kinds of things that have begun to emerge that I do hope will continue. I think one of the other real upsides that I've seen has been in some ways, the democratization of public process. And by that, I mean, rather than now going to City Hall and signing your name in the book to speak for 3 minutes to City Council, now you can do it from home, which really makes a difference for a lot of people with transportation issues, people with disabilities, people who are minding their children. I say all that with a giant asterisk, meaning it works great if you have internet in the home and you have a computer or you have a smartphone and you know how to use it. There's a whole bunch of people for whom that does not apply, who are left out of the process. So that's a problem. But I would say in general, it has allowed more people to become involved in local processes than before. So I think that's a good thing. And then the other thing I would say is, the degree to which services have now emerged that allow people to age in place better, such as grocery delivery. I think that is another kind of, small perk, if you will, that has maybe made it a little bit easier. I think about my grandmother who lived in her own home for a long time until she's well into her 80s. The only time of week she would drive out is to go to church and grocery store. It was usually the same day. Well, if grandma were alive today, and if she had a computer at home, and if she knew how to use it, she could dial into church from home and she could get her groceries delivered. And it's not that that's a perfect solution, because it still does put people at risk for isolation. But I do think that there are some things that we've learned here that can make it a little easier for people to age in place.
Thank you.
Sure.
Another question from the chat. Does the city of Austin or the state of Texas have any special programs to support the lives of those community-based older adults with dementia? Are there any efforts the city, government, or agencies are making that can make or develop dementia-friendly communities?
I think I defer to the Austin and Texas folks here to answer that one.
Tabitha, you probably have more to add than I do, but as far as the dementia-friendly community, no, I don't know of any initiative on that, and it's not something that we've talked about. Mental health, access to mental health services, is an issue in Austin, and for a number of the boards and commissions who I mentioned earlier who are part of joint inclusion in particular. And we do promote that dementia screening should be part of mental health screening because they're not exactly the same thing, through our advocacy for increased funding in that area. I don't know if Tabitha is still on, if she might have more particulars on that.
Yeah, I'm still here, everyone. I just wanted to add that that is a conversation that has come up in Domain 8, Community Support and Health Services, and we will continue to explore options on how we can collaborate and make sure that we integrate that dementia piece as well. So we have had conversations and discussed it.
Any other questions?
Well, Teresa, may I ask another one if there aren't any others?
Please.
Danielle, so you may have heard about this little thing we had in Austin called the Big Freeze when a number of us were without electricity and water for several days. And the community really came together to serve older adults during that time. Certainly Patty, Bordie, who's on our commission, Tabitha, led efforts, but there also were just neighborhood-based groups that that got together to get people water when the water was shut off and whatnot. And now we're doing a lot of retrospective looking at what happened, how could we have done better? So I'm wondering if you have any advice for that in that area. So emergency planning and preparedness, particularly around the needs of older adults.
I'm so glad you asked that question, Janee, in part because for lots of reasons. I mean, I know obviously the Texas has had its more than its fair share of disasters in the past several years. I mean, flooding and the more recent ice storm. I mean, it's been one thing after another, it feels like. We actually are working with FEMA right now. This is an area that I'm keenly interested in as well. And I feel as if it is the largest untold story right now in our country, which is how older adults are disproportionately impacted by disasters. You saw it in Katrina. We've seen it in just about every named hurricane that's come through our country. I mean, without a doubt, older adults will be among the bulk of fatalities for lots of reasons. Maybe it's lack of ability to evacuate, it's lack of transportation. Remember those folks who outlive their ability to drive but still live at home. Lack of funds, frankly, to evacuate, lack of funds to invest in hardening their homes or buying generators or doing the sort of risk mitigation investments that would be required to keep them out of harm's way, and many, many more. So what this work that we're doing with FEMA right now is twofold. One, they are developing a set of mitigation guides that are targeting emergency preparedness experts. So they're targeting FEMA people, for lack of a better word, on older adults. They have recognized that we've recognized there's a huge gap between those who advocate for the needs of older adults and those who are involved in the emergency preparedness disaster mitigation business. Those two silos don't often talk. So FEMA is writing a guide to expanding mitigation among older adults. At the same time, we are expanding or updating a toolkit that we've got that will be co-branded with FEMA on how local governments, local entities can better mitigate risk. So AARP does terrific work, I would say, already on preparedness. I think we're great at communicating on how to pack a go bag and make sure you have enough water, food, medications to outlast a disaster. But there are still community-wide efforts that can be brought to bear to minimize risk for older adults. And it really honestly goes back to making sure that emergency managers have met and know the needs of older adults before the disaster occurs. They know where older adults live. They know how to get in touch with them. They know what are the trusted sources for disseminating information. For example, older adults might not be getting the alerts on their smartphones that everybody else is getting, but they would be getting a phone call through that friendly voice program that Barry mentioned, or for information through the senior center, or maybe through the Meals on Wheels delivery, or maybe through the home and community-based service delivery folks. They are the ones who are in touch with the older adults. So let's utilize those existing channels to relay information about emergencies. So we've learned a lot of interesting and sad stories, frankly, about how things aren't working well right now. And I think it was evidenced, as you point out, Janee, but the biggest finding is creating those connections between those two worlds well before the disaster hits, because that is the thing that will make the difference in how older adults fare in the time of disasters.
Thank you. That's very helpful. And we'll be looking into those resources. At least here in Austin, our council specifically asked our commission for recommendations, and we have a working group working on that now.
Great.
And in addition, they created a task force and named our commission as one of the members.
Excellent.
So Austin is very in tune with the needs of older adults, and I'm very proud of that. But we also will take any resources you can share with us to give the city some ideas about what we can do better in the future.
Well, what's amazing is we've looked at the literature, we've looked at what practitioners are saying. There's not a lot out there. There aren't a lot of great recommendations right now. And so again, I go back to this, it's an untold story. It's an untold body of work that we have yet to sort of really fully explore and mine. So what we come out with, I think, will be the beginning, but I'm hoping this is something that we continue to work on at AARP over the next many years.
And that's a topic that we really want to cover again somewhere in this forum series, emergency preparedness, as we get further down the line, because it's top of mind for sure.
Yeah.
Other questions? All right. Well, I have some questions for you. Our next session is on May 13th, Thursday, May 13th. So put that on your calendar. We'll be talking about housing. And whether it's in the chat or if you want to unmute yourself, what are the issues about housing for older adults? What are your concerns about housing for older adults? This feedback will help us shape that program. Any thoughts? Affordability, for sure. Displacement from the community, missing middle housing, safety, housing connected to services and transportation. Great. Progressively increasing property taxes. Yeah, the whole taxes, property taxes is a big issue here. Housing connected to services and transportation. I got that one. Anyway, these are good. This will help us. Yeah, affordability. And Danielle, I know affordability in housing is not just an Austin problem, right? It's across the US. But how to make, home ownership or to keep older adults who want to age in place, how to keep them in their homes, or if they want that, it's becoming more difficult.
Yeah, agreed.
Yeah. Let's see more feedback. Cooperative housing models that might work here. I've seen issues with 50+ housing, allowing low income under 50 people to move in, and there has been an increase in crime and the over 50 population being unhappy and fearful of their neighbors. Yeah. Preventing evictions, universal design, easily modifiable settings. Excellent. All right. Well, we'll have a very informative session on May 13th. And again, plug in all the dates of our events, our future events, and we'll promote them as we go along. But this has been a wonderful kickoff session to our Age Friendly Austin forum series. Thank you, Tabitha and Janee, and all of our speakers and panels. I appreciate it so much.